Good morning, everyone. As we continue our session in this exciting conference, we're still on the theme of implementation science, and in this panel I'll be facilitating. We're going to discuss using implementation science to enhance global health. My name is Dr. Charles Ame. I'm a senior clinical lecturer here at the School of Tropical Medicine, and it's my pleasure to facilitate this panel. We have a very rich panel with several decades of experience in implementation science and research. I'll make brief introductions to the panel. Sitting with me here is Professor Sally Theobald. She doesn't need any special introduction. For those of you who missed the excellent keynote address this morning, it's on the app, it's online, you can still go back and watch it. But Sally is a professor of international public health and social sciences. She has extensive experience of collaborative research focusing on health systems in low resource settings. Sally, you're welcome.
Thank you.
Yes. My other panelist is online. She is Professor Imelda Bates. She's professor in clinical tropical hematology. She's the head of the Center for Capacity Research, honorary consultant hematologist, Royal Liverpool Hospital. She has several decades of experience, building capacity of researchers in low income settings. So she's going to be talking to us about, a systematic approach to doing this during this session. Imelda, you're welcome.
Thank you.
My third panelist is Annie Portela. Annie, glad to have you online. We had some technical glitch this morning. She couldn't join us, but right after this panel, she will give her keynote. So Annie is a senior technical officer based at the World Health Organization in Geneva. She has worked with governmental and non-governmental organizations for over 20 years in designing and implementing programs in maternal and newborn health. Annie, you're welcome. The last, but not the least panelist is Professor Jane Sandel, CBE. She's a professor of social science and women's health, Department of Women and Children's Health, School of Life course at King's College, London. She's a senior NIHR investigator. She's a lead maternal health systems and implementation research group. Thank you for accepting to speak. You're welcome. So I'm going to hand over now to Jane, and Jane will give us her first presentation. She'll be discussing using implementation science to enhance global health programs, complex interventions in global health settings. Jane, as you want us to move your slides, you just say next.
Thank you. And thank you for asking me to talk. I would also like to say I'm a midwife as well, so I combine my clinical experience with my implementation research. I can't actually see the slides on my screen, so perfect, thank you. Next slide, please. So you will have seen this same message earlier this morning, but the implementation challenge is that we have trials that show that implementations work in a trial setting, but then we fail to scale up, and it's hard to transfer from one setting to another because of differences in context. So how can implementation research, when it's combined with complex intervention research, inform scale up? Next slide, please. I am going to give you a brief example of what's called an effectiveness implementation hybrid trial. In effect, what we did was test the effect of the intervention as well as the data on implementation. Next slide, please. Why is it necessary? We're trying to understand the mechanism of the intervention. so that we will know better if it will produce the same outcomes in new contexts, so we can better understand why there was no effect and how it benefits the target population. Next slide, please. Our work is drawing on the MRC guidance for developing and evaluating complex intervention, and I've added to this slide where implementation science contributes all the way through of development and testing and scale up of interventions, starting with doing theory and change and logic models in the development, with testing implementation strategies and doing process evaluation, to doing an implementation evaluation in a full-scale trial. Next. There is detailed guidance from the MRC on how to do a process evaluation. This is complicated and draws on how we can talk about impact of context and mechanism of change. And I'm going to talk about how we drew on this guidance in a pragmatic trial. Next slide, please. So I'm going to talk about lessons learned from doing an implementation assessment alongside a pragmatic trial. It's called the Cradle 3 trial. It was funded by the MRC and Gates, and it was testing the Cradle Vital Sign device plus educational support in 8 low-income countries in all settings with all health workers, with the aim of reducing maternal mortality and morbidity. I've put the implementation strategies up there, and there's much more detail in the 2 papers that I've referenced. Next. So the aim of our implementation evaluation, and remember this is a pragmatic trial, so we didn't want to put a huge amount of resource to support implementation in the trial because that wasn't going to happen in the real world. So we wanted to describe the implementation, and we wanted to look at some of the implementation outcomes to see whether that may explain the differences of effect in the different sites in this step wedge trial. Next. I've put here our model of what we were looking at. So was it delivered as planned? Did it reach the women who we hoped it would reach? How much was delivered? Was it adapted? And could it be sustained? And we wanted to look at impact and unexpected pathways and acceptability. The main outcomes of the trial I've put up on the slide here. Next. This is a complicated slide. It's for you to look at afterwards, but I wanted to give you an idea of what we were able to look at, looking at context, how we measured fidelity, how we measured reach, and how we measured adoption. Next slide, please. So in terms of fidelity, we trained just under 2,800 health workers. Sorry, I've lost my main screen. But the range was large, from 16% in Kampala to nearly 90% in Malawi. We delivered the key content, and the majority of participants reported the training was adequate. Next. In terms of adoption, I've put some data here that we collected, and again, a huge variability in whether the sites were able to adopt the cradle device and some of the barriers to adoption. in terms of mistrust of using a new device, and the different results you can get from blood pressure monitoring machines. It was really important to have the active support of the Cradle Champions on site. Next. In terms of reach, we managed to have a significant increase in women who received blood pressure measurements after the intervention, better availability of the equipment on the site, and junior staff and students were more confident in taking the measurement. Next. So the results are in the two papers I've given you reference to. There's huge variability in effectiveness by site, and the overall result when you took confounders into account was no effect. And of course, with a step wedge trial in each site, what you have is a before and after measurement. Next slide, please. So what did we learn? We learned it was possible to do a hybrid effectiveness trial in a pragmatic way in low resource settings, that you could evaluate process measures, that the ones we chose were appropriate, but it is challenging to describe context and mechanism in a more sophisticated way that's described in the MRC process evaluation framework. And there's very little guidance for how you combine implementation science in the pathway of developing a complex intervention. Final slide, please. So what do we need to know? We need to know that we need to have a very good description of what is being implemented, who, what, when, where, how, what the strategy is, what the setting and the context is, whether the implementation outcome variables are appropriate for the study and the site, and how we consider secular changes over time. So for either any research assessing complex interventions, trials, or whatever design, these are really important questions. Next slide, please. I'd like to acknowledge the Cradle team who are here, and the chief investigator and the lead of the trial, who's the lead author on the publications. And there is a reference list that I've added onto the presentation. So thank you.
For that excellent presentation. I just want to remind conference delegates that you can put in questions through the app for Jane. We will take the questions after Imelda gives her presentation, which is titled A Systematic Approach to Strengthening Capacity for Implementation. So please, over the next few minutes, please put in questions that will help us get discussion going in this panel. Imelda, over to you.
Thank you very much, Charles. Can you hear me okay? So I'm going to discuss a systematic approach for how to strengthen capacity for implementation research. And it follows on from Jane's very eloquent description of how to use implementation research within a complex project. So can I have slide 2, please? So why is it important to strengthen capacity for implementation research? And I hope that Jane's presentation has illustrated why it's really important to have enough people that can do high quality implementation research. A lack of implementation research capacity is a major bottleneck in enabling people to turn research findings into actions. And as a result, it hinders socioeconomic development if you don't have enough capacity to do implementation research. Also, funders are increasingly investing their money in strengthening capacity because they recognise there's a direct link between implementation research capacity and development. But they need evidence of where this money's going and how it's being spent and whether it's been effective. As you'll all know, those people that write proposals, in many proposals, you are required to write something about capacity strengthening and to show systematically how you've achieved impact. Can I have the next slide, please? So just to explain a little bit about how we have some legitimacy within our centre to be able to talk about strengthening capacity for research. So we do a lot of practical projects where we do implementation research, but we also do a lot of theoretical studies, and we produce a lot of evidence and concepts around how to do better capacity strengthening for research across the whole research system. So just click again, the next box should come. So we generate transferable evidence about how to do, track and measure the impact of research capacity strengthening programs. So you can see that that's helpful to researchers and implementers and also to funders. Click again, the third box should come. Thank you. And therefore we do collaborate very closely with funders and the implementers, and we tend to sit between the funders and the people on the ground. Slide 4, please. So I just want to stress that the principles that we use for strengthening capacity for research can apply to any research topic. The principles I'm going to talk about are not restricted to maternal health, although we have used them for maternal health. I'm a haematologist, so a lot of my maternal health work is around anemia and blood transfusion. But we've also, for example, used the same principles on soil science and termite hills and nanotechnology for solar panels. So it can apply to anything. Next slide, please. So how do we take a systematic approach to strengthening capacity for implementation research? So the first important principle is that we have to think about the whole research system. When people think about capacity strengthening, they often think about training researchers, but it's much, much broader than that. And training is a minor component actually of all the other inputs that need to go into the system to strengthen a research system. When we think about designing capacity strengthening, we think about it under two concepts. It's a very complex subject, and so for me and the rest of our team, we've had to turn it into some simple ideas that we can deal with and that we can use across different projects. So there are two simple concepts. One is about a prism, which I will talk about in a second, and then we take a 5-step approach. We adapt it sometimes, but we always think about these 5 steps. So if you click again, you'll get the prism. So if you click twice, you'll have a circle around the whole system. So the research system comprises the individuals, the institutions in which they work, and around this are things like research culture and the research infrastructure that makes a conducive environment for those individuals to do research. And then at the bigger level, we have something called environmental or societal level. And this refers to national policies, international collaborations, uptake of research findings. So those 3 levels constitute the whole research system. If you click twice again, and you see that the process of strengthening capacity, it's not really a linear process. There are lots of reflections and looking back and learning and redesigning. But overall, you start with some planning, then you do try something out, experiment a bit, but build in a lot of learning. And then when you find that something works, you can expand it and consolidate. Next slide, please. So there's a 5-stage process that we always follow if we're designing a capacity strengthening programme. And although we may not apply all of these, we may not have money or time to do that, we always think about them. And I think Jane stressed how much it is needed to do the planning up front. It's really important to plan properly. And one of the things that we find is often missed out is that people just don't define the goal of where they want to go. Where are they trying to get to with their capacity strengthening project? Do they want their centre to become a centre of excellence for maternal health? Or are they trying to turn it into a training centre for something? If you don't define the goal of where you want to go, then you don't know if you're going to get there and you can't map out a pathway. So I'm not going to go through all these steps in detail, but just to say that having defined the goal, which is difficult, it requires all the stakeholders on board to get a goal defined that they all buy into. And then once you've got the goal, you have to look through the literature, talk to everyone and try and describe what the optimal capacity is if you want to achieve that goal. And that means across the whole research system, not just training. And then once you've worked out what the optimal capacity is, you can use that as a sort of benchmark or checklist against which to look at what capacity is already existing. And then you can very systematically identify any gaps. And obviously, once you've done that, then you get into a normal sort of action planning cycle where you try and fill the gaps in capacity, see if you've filled them, look for other gaps, and continue on like that until you finally reached your goal. Next slide, please. So some of the things that we've learned through being involved in many projects, we've currently got 14 projects, 70 countries involved, many consortia, and we've learned a lot by being able to pool information across all of these projects. So some of the lessons that we've learned that it's worth thinking about very early on if you want to sustain any of your implementation research capacity is that early on you need to engage all stakeholders. I can't stress enough how important it is to get everybody on board, that everybody buys into plans for scale up and you think about them early and how you're going to influence policies and get your research taken up. I know that's something that you actually do nearer the end of a project, but if you don't plan at the beginning, it's really hard to build it in later. And include all the way through these quality assessments and learning so that everybody understands why changes are being made, why you're progressing or why you're not progressing. At mid-time in the project, by that level of time, you should be able to see that some of the resources that you've got are being improved, people are getting their skills, you might have improved the infrastructure in an institution, and the activity should be being taken up by an institution or by a program so that they're not dropped when the project comes to an end. And at the mid stage, there should also be some evidence of innovation and expansion so that you're not just working within the confines of the project, but that you're thinking outside the box and trying to bring on, for example, new partners. And then towards the end of a capacity strengthening project, you would really expect to see that there had been some investment in core activities and that that was going to continue on. So there'd been additional funding to support some of the core activities that aren't normally funded through projects, and that a lot of the decision-making management, as much as possible, was led by local partners who understand the context and need to have ownership in the long term. So there are three things that almost everybody struggles with when they're trying to sustain any sort of change, and particularly change in research systems. There's often a very high turnover of staff and stakeholders, so you need to keep going back to them to make sure they're all engaged. Trying to embed changes within existing systems, because that's the only way they're going to sustain, is very hard and needs a lot of thought and effort. And obviously securing funding and influencing policy development are also very difficult and need to be thought about all the way through. Next slide. So this is my last slide. I'll just leave you to read those comments from some of the participants that have been involved in some of our projects about building implementation research capacity. Thank you.
So we've listened to two very rich complementary presentations, which have really outlined, the difficulties in conducting implementation research, even with very comprehensive frameworks and guidelines that are available, usually through funders. We've also heard about an effectiveness implementation hybrid trial, and some of the difficulties and challenges when you conduct such trials, especially in resource-poor settings. A lot has been said throughout today about the need to get stakeholders on board early, engage them early, not just at the end. There's a big question of what happens once the project ends. So once all the project staff have packed the things and gone, and you come back in 3 months' time, then its history is all over. So, but how do we sustain this? It's only by really engaging, with partners on the ground quite early. So, some very interesting threads that have come through both presentations. Let me just turn to Annie. What do you think is the role of underserved populations, women and communities in the design of health programs and services?
Let me unmute. Thank you. Just let me start by saying thanks to Jane and Imelda. I really felt they got us off to a good start. In your summary, Charles, you captured, again, to me, it's impossible to think about implementation research if we're truly trying to develop a model for implementation, if we are not working closely with, and I'm going to add, health providers, women, communities, local authorities, because one, in order to design and develop that local model and integrate your proposed intervention, either simple or complex, into the system, it can only be done through consultation and through a design process that allows these inputs and allows the ongoing dialogue and advice to, again, make sure the implementation is integrated. Otherwise, we do risk that it is more of a research project. And so, it shouldn't be because the research part closes that the implementation stops. Now, the research part does give that push, if you will, to the implementation part because of that maybe more intense monitoring that happens, the more follow-up, and as Jane was saying, that eye to the quality of implementation. But in terms of their role, it's just so key, not only for design, but throughout the life of an implementation research project. Over.
Thread coming through there. One of the things in Jane's presentation, she talked about barriers to using the new device, the Cradle device in that study. And she emphasized the role of the Cradle champions. And I know in your presentation, Sally, this morning, you talked about the importance of local implementation teams. Mm-hmm. So how important are those teams to ensuring sustainability and acceptance of research findings?
Sure. So I think that having implementation research teams that come together, come from different perspectives, it lies at the heart of a lot of successful implementation research processes. And we talked about the importance of bringing different perspectives and different positionalities to bear in implementation research. And Annie's just highlighted the importance of communities themselves, women, children, others, as being part of that process. So yes, implementation research teams, collaboration, co-production, partnership, trust, all those issues we talked about this morning, I think are critical and are part and parcel of co-production. We know that people working, living, breathing in health systems have that tacit experiential knowledge. And it was really, Jane, I really enjoyed your presentation and learning about a hybrid effectiveness pragmatic trial. And in the slides I gave this morning, in terms of the spectrum of implementation research, it was a lovely example of implementation research embedded within that pragmatic trial, and also of learning across multiple contexts. And it would be really nice to learn more about those cradle champions and their role and how that differed, and with respect to sustainability, what happens after the trial? Does that role still exist? Is it still required? Or is this learning embedded within the system already?
Thank
I had
you.
another comment. I don't know if I can make it.
Go on.
Just to link with Imelda's presentation and the projects I talked about this morning, many of those collaborate and have benefited from expertise for the Centre for Capacity Research. And I really like the holistic prism, looking at the research ecosystem as a whole. And it really reminds me of health systems as complex adaptive systems. And that's what we're doing in implementation research, right? Thinking about health systems as a whole, how do you build capacity within and across all the actors that are part of that ecosystem? So holistic learning at those multiple levels in terms of environmental, social, institution, and individual. Thanks.
Absolutely. Thanks, Sally. Thanks for that. So I think one of the things we have really talked about today is, the changing context. And in Sally's earlier presentation, and in the presentation that followed from colleagues from the WHO, from Africa CDC, I mean, these are changing times. A lot of things are constantly changing on the ground. So without good engagement with local partners, we cannot learn from this process and we cannot adapt in such a way that we have a fine balance between research and then bringing about evidence-based changes. One of the questions that has come through is how relevant is implementation science to health systems strengthening? I wonder which member of the panel wants to take this one on. Jane, do you want to have a go? How relevant is implementation science to health systems strengthening?
Well, I think it's relevant to all research questions, to be honest. I really don't think you can do good health system strengthening research without involving those different approaches and methodologies and tools that implementation science can offer.
Thank you. Annie, do you have anything to add?
Yeah, I think all of us will kind of make a similar comment, is that, we just learn more and more that a lot of the recommendations that come out, a lot of these best practice, a lot of the key interventions, all are so linked to the health system and the context. And so, if we don't have these methods of learning, either through implementation research or embedded practices of learning, I find a lot of the times the health system strengthening can remain either vertical or theoretical. So it's only through that process of embedding it, of trial and error, of learning, and of a broader engagement with a group, of different, as Sally said, different constituencies who can input and help that. I mean, I just feel the question is almost, I want to just say a simple yes, of course. Yeah, it is really, so linked.
Okay, thank you, Annie. So one question is about, what are the additional challenges to implementation science or research uptake in informal, fragile settings, informal urban settings? Are there additional specific challenges? Sally?
So I think what's key in implementation research is that context matters.
Yeah.
And there are a whole multiplicity of contexts that we work with in implementation research. So I gave the example this morning of Rebuild for Resilience, which specifically focuses on fragile and shock-prone contexts, and also of Arise, which specifically focuses on informal urban contexts. And I think that the principles in those contexts are similar to others, right? We have to find the most appropriate people to engage with in those implementation research teams to build trust, to support the principles of co-production. And we know that in fragile contexts, that can be complex.
Yeah.
Post-crisis, post-war, during a pandemic, there may be multiple players involved. There will be multiple players involved. It can be fluid, it can be changing, it can be complex. So it's what is the best way to build those partnerships in a changing and evolving system. And that's going to depend on the issue, on the context, on the type of fragility. And it's about partnerships with embedded people and institutions that can shape and bring positive change. In Arise, I talked about the different partnerships, and we're really privileged to collaborate with Slum and Shack Dwellers International, a federation of people living and working, and NGOs and others in slums and informal contexts across 38 different countries. So really understanding and being part of the lived realities in those contexts, those are groups that understand the nuance, understand the ways vulnerabilities play out, understand the challenges to accessing health and how COVID is overlaying that and amplifying new vulnerabilities. So that to us has been an amazing partnership. So what I'm trying to say, probably not very eloquently, is the context will shape the partnerships. And we need to build partnerships for change, whether that's an urban context, whether that's a fragile context, whether that is a hospital context. It's about working to nurture trusting partnerships for change and the co-production of knowledge.
Absolutely. So I think one thing that comes out consistently is the need to do adequate planning and starting early, because if you don't understand the context from the beginning, you can't identify the right partners. And in Imelda's presentation, she talked about some of the challenges around sustainability and getting things to change, the high staff turnover. So we need to build those relationships at institutional level, identify the right key players to help us understand the context and bring about lasting, sustainable change. In the last few minutes we have, I just wonder what will be the advice of the panel. You have a lot of young researchers, people going new into implementation science. What are the things they should look out for when they are making grant applications? What are those things they need to embed within those applications that will help them get success? And what are the key take-home messages in terms of being a successful implementation science researcher? So maybe we'll just go around. We can start with Imelda.
I would just pick up, Charles, some of the things that you just said. I think if you're starting off in the field, you should plan your capacity strengthening for research with exactly the same rigor and thought that you would apply to any other research project. If you want to do it properly, you need to plan early, you need to know what your pathway is to achieving success, and you need to understand how you're going to measure and show success. And I think if you have to write about capacity strengthening in a grant application, you need to do it in a very systematic and rigorous way like that. I think if your funders and you're funding capacity strengthening for research, whatever research, but particularly implementation research, that you need to be thinking about meaningful indicators. If you really want it to happen, to be sustained, to be impactful, then you have to be serious about having indicators, evaluating the proposals with regard to the rigour with which capacity strengthening plans are written in there, and also monitoring progress in strengthening research capacity across all those levels. In general, it's done in a very perfunctory way, and I think researchers know that's how it's done in terms of evaluating their projects, and therefore they don't invest the time and energy that's needed to make it impactful and sustainable. And I think, again, picking up what Sally said and everyone else has said, that context is really important. So I think being flexible and responsive and proactively building in learning at every stage and using that learning to improve the programme and make sure you don't make the same mistakes again is also critical. Thank you.
Thank you, Melda. So some fantastic words of wisdom there. I mean, we cannot underscore the importance of early planning. You need rigor, a systematic approach. You need to build a system of learning and documenting, what has worked well, what has not worked well. How do you measure success in terms of process and impact? This needs to be thought through very earlier on. And then, something that came out from Melda's presentation was, the need to be able to identify those research capacity needs of the local team. This is something that you have to do to build into, the grant applications and for success. Jane, any final words of wisdom for, our young researchers?
Yeah, very practical, very practical.
Yes.
So one, get your team right. Very often there's a lot of inequity between high income partners and partners from low income settings. And many times, voices that should be on the collaborating partnership are not there, even though the research is about the work they do. And I give midwives as an example that are often missing from grant applications. Give cognizance to the people from the setting where you're doing the research. They are the experts. They know what the problems are. The problem should arise from low income partners and settings. With intervention research, describe what the intervention is and describe how it's going to be delivered. And there are reporting templates for how you do that very simply. Describe your implementation strategy and give some kind of indication of how you think it's going to work. Open the black box. So someone who is reading your application can think, okay, yes, I can see if they do that, then that will happen, and then that would have an impact on those process and outcome measures that are in the application. I can't emphasize how important doing theory of change early with all the stakeholders and community partners is to get this right, and to doing a logic model. I think they're fantastic for getting the team around the table and all the key stakeholders as to what you're planning is the right thing and how you think it works and how you're going to measure that so everyone's on the same page.
Thank you very much, Jane. So again, the issue of adequate planning, and then, as all the speakers have emphasized, the issue of equity in partnership, and also recognizing the value of those stakeholders on the ground who are the experts in, their problem, and they know the solutions, they know, the practicalities in getting around things. So engaging them early, she talked about opening the black box. We need to anticipate what the problems are, develop a very good theory of change with all the relevant partners, so you can track progress and success. I like the way Jane has really advocated for midwives. In this International Year of Midwives, it is quite important that, we have equity, within that team. As we round up this session now, I just want to say big thanks to all the panelists. Thank you, Jane, Sally. We have pulled you out from your busy schedule today. We've had you for more than half a day, you know, we've been back and forth, troubling all the panelists with the presentations, getting ready for this. And I think it was a fantastic panel and lots of lessons to learn. I just want to the participants to know that these the video will be available online for some time, and you know, you can always access this content, and you know, the slides are there for you to look at, a lot of frameworks and references that have been put through. Immediately after this, we're going to have the keynote by Annie, which we missed out in the morning. But in order to access that content, you will have to come out of this and then click on the link through the app for that keynote presentation by Annie Potella. So I just, once more, I want to thank all the panelists, and I encourage you to continue with the rest of the conference. You know, we still have a lot of packed evidence and experience to share throughout this conference. Thank you. Those long summers.